Hi guys, welcome back to Kind Pediatrics. If you're a mommy and you're thinking about breastfeeding and you're wondering what you could do to potentially increase your success, this video is for you. Today we're going to talk all about how to prepare for breastfeeding in the third trimester. In the video, I might reference specific brands that I recommend having on hand. I'm not sponsored or receive any kickback from any of these companies. It's just things I generally recommend in my practice on a day-to-day basis.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
So the first thing I actually recommend that you do is to start to prepare, and this begins, like I said, in the third trimester. So you want to have some things available to you when you come home from the hospital. So the first piece of equipment that I recommend that you have is a pump. For most moms, I don't recommend that you start pumping until at least 3 or 4 weeks when your breast milk supply is established. Pumping before then can lead to oversupply, but there may be a situation in which your lactation consultant or your breastfeeding medicine doctor, or whoever you're seeing for your lactation needs, recommends that you start pumping early. And in those cases, it's helpful to have the pump right away. Secondly, for many people, their insurance company will cover their first pump. And so it's nice to have those things sorted out ahead of time instead of trying to buy it in a rush and then you're not using your insurance to pay for it. I also recommend that if you're purchasing your pump, that you look into bottles or devices where you can pump straight into your storage device. There is some evidence that when we transfer breast milk from the breast pump containers to the bag to bottles, with every transfer, you lose potentially some nutrients that adheres to the container itself. So it is helpful and convenient to be able to pump directly into your storage and feeding material, whatever that's going to be, a bottle or a storage bag. For moms looking for a bottle that's compatible with multiple breast pumps, the Lifestyle bottle is one that is compatible with a few different types of breast pumps, and it's glass, which is also nice because there's some evidence that glass may again be a little bit more sterile and help with reducing the loss of micronutrient in the storage bag itself. Secondly, I recommend all moms who are thinking about breastfeeding to take a breastfeeding class, and ideally this should occur again in the third trimester. If you take it earlier than that, probably you're not going to remember some of these details when it comes time to breastfeed. And you don't want to wait until after baby has arrived because breastfeeding really ideally should start the first hour that baby's born. Sign up for a lactation class or a breastfeeding class just to empower yourself with some of the knowledge about what a basic latch looks like, some of the basic body positioning techniques, and a lot of information, like I said, about that first hour or sometimes referred to as the golden hour. Thirdly, I recommend that you do make an appointment with a breastfeeding counselor or consultant or IBCLC, CLC, whoever you want to use for your breastfeeding support. Make that appointment ahead of time and establish that care again in your third trimester. We know evidence shows us that moms are most likely to quit breastfeeding within the first 3 to 7 days when they get home due to a lack of support. So help yourselves out there and have that appointment within the first 2 days of coming home so that you already have that support in place when you leave the hospital and you're at the most vulnerable potentially for not continuing to breastfeed if this is a goal of yours. Other things you might want to have ahead of time are a breastfeeding bra. So a nursing bra is going to be ideally wireless, no underwires. Any compression on your breast itself can actually lead to reduced milk emptying from that part of the breast, which can be a setup for mastitis, which is an infection of the ducts of the breast. Additionally, milk removal is one of the big signs to send that your body gets to make more milk. So the more milk that's removed, generally the more milk that is made. And if you have an area of the breast that's not draining appropriately, it might send the message to your brain that you don't need more milk to be made. And in the first 4 weeks, when you're establishing your supply, it's really critical that the breast is completely draining and appropriately draining. You also may want to have a breastfeeding shirt. So that can be, it doesn't have to be like a specific shirt that's made for breastfeeding. It can just be something that unzips for quick and easy access. Traditional shirts like the one that I'm wearing, it would be very hard to get a baby to my chest wearing this. So have something that either unzips or get yourself a few breastfeeding shirts or dresses that make the access for you a little bit easier. Most babies are going to feed 10 to 12 times a day. That's every 2 hours. You don't want to have to be taking off a shirt and getting a shirt dressed every hour or so. I also highly recommend that mommies get themselves a breastfeeding pillow. So this is just an example of one. This is the one we use here in our clinic. But the important part is that you can put baby on the pillow and give your arms a little bit of rest and your shoulders some rest. So you can see this baby can kind of nicely lay on this pillow. It also comfortably, because of the U shape, wraps around me. So it's not pushing on my belly or my uterus postpartum. It's really, really helpful to have one of these, not only for proper positioning, but again, for support so that your back and shoulder muscles are not getting cramped up and overly used. The other thing I really recommend having in your third trimester is a good prenatal vitamin. You should ideally have this from the start of your pregnancy. Arguably, when you're thinking about getting pregnant, you should start your prenatal even then potentially, but you definitely want to have a good prenatal in your third trimester and continue it through the duration of your breastfeeding. In addition to an electronic pump, I also recommend that you have a handheld pump. So something like the Haka or similar works really well for a few reasons. One, your lactation consultant or breastfeeding support may recommend that you do some hand expression to increase your supply. And it can be helpful to hand express directly into a handheld pump like the Haka. Secondly, if you are experiencing mastitis or you're getting lumps or clogged ducts or just having general oversupply, it's again, the Haka can be used really nicely or a handheld pump like that to help unclog ducts. So I would definitely recommend that you get one of those ahead of time. You'll also want to purchase some pads to put in your bra to help if you leak. It's not uncommon for breastfeeding mamas to have some leakage throughout their breastfeeding journey, and it's a nice and handy thing that you can just throw away instead of having to wash your bra. And it's also nice because it just provides an extra level of knowing that you're not going to leak through your shirt. The next kind of piece of equipment, if you call it that I recommend that you have ahead of time is a nursing cover. Certainly you should feel free to nurse without a nursing cover anywhere that you choose, but if you know ahead of time that you're not going to be comfortable with that, a nursing cover is a really nice way to be able to still go out and breastfeed. There are wonderfully beautiful nursing covers made nowadays, like Quince has one and iMama has one. They're breathable, they're comfortable, and they look nice. And so you might want to think about purchasing one of those again ahead of time to have. And the last thing you might want to consider is having some sort of baby carrier or baby wearing device. Well, you can look at my video on baby wearing to talk about all the benefits of baby wearing and how to do this safely. But one of the benefits of baby wearing is increased breastfeeding success. So it might be helpful to have one of those ahead of time. You'll also want to have some bottles and nipples picked out ahead of time. For the first 3 weeks, I recommend exclusively breastfeeding at the chest. But after that, I do recommend introducing a bottle, and you can reference my video on bottle introduction for breastfeeding mamas on how to do this, but you will want to have a few handy ahead of time, or in case breastfeeding isn't going exactly the way that you hoped, it's helpful to have some bottles and nipples handy in case you need to supplement formula. Non-equipment things, but things that I would put on your checklist to do in the third trimester include things like talking to your physician. So talk to your breastfeeding doctor, your pediatrician, your OB-GYN ahead of time. Express your desire to breastfeed. Ask them, is there anything in my medical history that might make breastfeeding a little bit more challenging for me? So some examples of that might be prior surgery of the breast ducts and nervous system are really important in hormonal feedback and production of milk. And so any scar tissue or cutting of the breast can sometimes make that harder. Things like diabetes, hypothyroidism, polycystic ovarian disease, these are all risk factors for having a little bit of a more difficult time breastfeeding. It doesn't mean it's impossible, but it's helpful for your doctor to be aware of that ahead of time because you might be someone that they want you to get even extra support from lactation before and have in place for after your baby is arrived. I also really highly recommend that you find and join a breastfeeding support group. La Leche League is a great resource for that. There's tons of mommies in your community that you're going to find really helpful in your breastfeeding journey. There's just some information and knowledge out there that's kind of generational and passed from women to women that you can't find online. And in general, just having that emotional support is great. So if you're really thinking about breastfeeding, I highly encourage you, get on a support group early, sometime in your third trimester, and have that in place for when you leave the hospital. You're also going to want to potentially make sure that the hospital that you're delivering at has lactation consultants. Like I said, breastfeeding starts immediately after birth, and that first hour is really important. And it can be really, really helpful to have that guidance and support in place while you're in the hospital for the first 24 to 72 hours. And lastly, make sure you have tons of support. Breastfeeding is a full-time job. There are studies that quote that it takes about 40 hours a week, if not more, to successfully breastfeed a newborn. That is literally a full-time job. Make sure that you don't have other full-time jobs on top of this. So meal prep, meal planning, cleaning the house, all of these other things that are potentially on your to-do list, make sure that you have support and somebody else who's going to be able to complete these tasks for you. Because you're going to be really working really hard, mama, to keep your baby alive and fed. Try to make sure that you don't have too much other stuff on your list as well. I put together a really nice checklist for you all about all of these things I talked about that you kind of want to check off your list. If you're like me, I'm a checklist person. It can be helpful to just have a visual reminder of things that you need to get done or may want to get done in your third trimester while you're preparing for breastfeeding. The other question I get a lot from mommies, because our care actually starts in the third trimester, is about their diet and about their prenatals. So the first thing I want you mamas who are considering breastfeeding, and all mommies actually in general, to think about is avoiding toxins. So you want to avoid things like cigarette smoke, any secondhand smoke actually in general. You want to avoid not only prenatally, but postnatally as well. You want to be mindful about the types of fish that you're consuming. Certainly high mercury containing fish like those deep water cold fish, salmon and tuna. Just be mindful about the quantity that you're taking in. If you have the ability to think about the way or where you're getting that fish from, wild caught or like pole caught is obviously a better choice if you can do so. You'll also want to avoid other toxins like alcohol if you can pre and postnatally. And think about your diet a little bit. There are certain micronutrients that are a little bit more important for the developing brain than might be not part of your diet right now. So things like choline, which you can find in eggs. Think about the iron or iron content of your food. So you can get that from beans or dark green vegetables. You'll also want to think about vitamin B, which you can find in leafy green vegetables, as well as good healthy fats. Avocados, things like that are a great source of healthy fats. So you're looking for similar things in your prenatal: selenium, choline, vitamin A, D, and E, vitamin B12, iron, zinc, iodine, DHA, and EHA, to name a few. Another common question I get is about the amount of calorie consumption. You'll read a lot online. The most quoted is breastfeeding mamas need about 500 more calories a day. I would say to not focus on the amount of calories that you're eating or adding extra calories into your diet, and instead advocate for eating a well-balanced whole food diet. So try to eat foods that look like the way they came out of the ground or from nature. Try to focus on balance in your diet. There is a decent amount of evidence that most mommies do not need extra calories to breastfeed. So as long as you're nutritionally sound and well-balanced, you don't necessarily need to add extra calories into your diet. Adding more calories will not make you make more breast milk, but instead taking care of yourself holistically. Take care of your sleep, be mindful of your stress, make sure you're drinking enough water, and making sure you're eating a well-balanced diet will help you be healthy and therefore be more able to breastfeed and respond more appropriately to your baby's cues. But adding things like lactation cookies or oatmeal or adding more calories into your diet is not actually evidence-based for helping you make more milk. And I would say it can be a little dangerous in the opposite. So adding in way too many extra calories is detrimental to your health and actually going to hurt your ability not only to breastfeed, but your own health personally, which we never want. Similarly, I get a lot of questions about hydration. How much more water should I drink? Again, you want to actually just focus on your overall wellness. There's no evidence to suggest that drinking more water or drinking certain types of fluids increases milk production. But instead, mommies who are overly tired, overly stressed out, running on zero, and therefore not drinking enough water and not eating enough and not getting enough rest, have a harder time breastfeeding because they're not taking care of themselves, not because certain types of drink or hydration or food help us make more milk. Milk production is really based on a few things. So removal of milk and proper stimulation of the breast, and not necessarily things in our diet. So I hope you found this video helpful and encouraging. I would say my big takeaways for mommies who are thinking about breastfeeding is knowledge is power, empower yourself, and take care of yourself and show up for yourself. Make sure all of your glasses are full, your emotional cup, your rest cup, your exercise cup, your nutritional cup. And that's really the best way to prepare for both your baby and your breastfeeding journey. If you have any questions or concerns, please drop a comment below. I'm always happy to hear from you guys and answer any questions that you have.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.